Hello and welcome. My name is Deborah Duran. I am the Director of Sales and Marketing for Stanford Healthcare Advantage. Today, I will be presenting Stanford Healthcare Advantage HMO Medicare Advantage Plan for 2020. Stanford Healthcare Advantage is a Medicare Advantage plan with a Medicare contract. Our service area includes Santa Clara, San Mateo, and Alameda County, and we are a 4-star plan. I will review the Platinum and Gold plans and demonstrate how the synergies between the Stanford Healthcare Networks and the Stanford Healthcare Advantage Plan provides our enrollees an end-to-end care experience. Finally, we will conclude with a review of the available resources and the next steps that enrollees can expect once their application has been accepted. Let's begin. I am a licensed insurance agent by the state of California and certified by Stanford Healthcare Advantage to present the plan. I do not work for or represent any governmental agency, and I will be discussing Stanford Healthcare Advantage's HMO plans, and I am compensated if you enroll. A review of the Medicare program basics. Are you eligible? You're eligible if you have Medicare Part A and Part B, you live in the plan service area, Santa Clara, San Mateo, or Alameda County, and do not have end-stage renal disease, ESRD. As a reminder, you must continue to pay for your Part B premium. Now that we reviewed the eligibility requirements, we can discuss Medicare enrollment periods. When can you start your Medicare Advantage coverage? First, we have the initial coverage election period, ICEP. Upon your 65th birthday or other unique qualifying events, you become eligible for your initial coverage election period. It's a 7-month enrollment period. The ICEP begins 3 months before your 65th birthday and ends 3 months after. An important note, if you do not sign up for Medicare when you're first eligible, you may have to pay a late enrollment penalty. When can you change your Medicare Advantage coverage? You can change during the annual election period, AEP, October 15th through December 7th. This is your opportunity to change your Medicare Advantage plan and/or prescription drug coverage for the upcoming year. Coverage will begin January 1st. In addition, you will be able to make changes during the Medicare annual open enrollment period, January 1st through March 31st. The Medicare Advantage Open Enrollment Period, MAOEP, in 2020 may let you switch plans. At that time, you can drop your Medicare Advantage plan, return to traditional Medicare, and then sign up for a standalone Medicare Part D prescription drug plan. You generally can't make other coverage changes during this period. You can also make a change if you have a special enrollment period, SEP. Special circumstances may enable you to enroll or change your Medicare plan during the year. Here are some examples. Move out of your plan service area. Retire or lose employer coverage. Qualify for low-income status. Gain or lose Medi-Cal coverage. Your SEP starts the first day of the following month. Now that we reviewed the Medicare enrollment periods, let's explore Medicare program basics, the A, B, C's, and D's of Medicare. Part A, hospital insurance, provides coverage for inpatient hospital care, skilled nursing facility care, home health, and hospice. Part B, medical insurance, provides coverage for doctor's office visits, preventative services, diagnostic tests such as labs and X-ray, durable medical equipment, outpatient surgery, emergency or urgent care. Please note, you may pay a penalty if you do not sign up when eligible. Part C, Medicare Advantage, provided by insurance companies like Stanford Healthcare Advantage and offers all the services traditionally provided under Original Medicare Part A and Part B, and can include your Part D coverage and typically provides additional benefits. Uses network providers to receive benefits. You can enroll in Medicare Advantage if you actively have Part A and Part B. You must continue to pay for your Part B premium, live in the plan service area, and do not have end-stage renal disease, ESRD. Part D. Let's review the Medicare program basics for Part D coverage. Annual deductible. Some plans maintain a deductible requiring you to pay a total cost of your drugs until you have reached a set amount. The initial drug limit is $4,020 in drug costs paid by you and the plan together, meaning the times when you pay a copay or coinsurance and your plan covers the remainder. Coverage gap is the cost of drugs paid by you and the plan together. Once you and the plan have paid $4,020, you are in the coverage gap. At this point, you will pay 25% for the cost of name brand drugs and generics. Catastrophic coverage begins once you and the plan together have paid $6,350 in drug costs. You will then pay a small copay or coinsurance amount for remaining drugs needed. Please note, Stanford Healthcare Advantage does not require a Part D deductible for the Platinum Plan. There is a $250 Part D deductible for Tiers 3, 4, and 5 for the Gold Plan. Those with LIS assistance, low income subsidy, will have a different cost share. LEP, Late Enrollment Penalty. If you did not sign up for a Part D plan when first eligible, you may later be subject to premium penalties. With the Medicare program basics covered, we can have a more meaningful discussion about Stanford Healthcare Advantage and the plan in which you may be enrolling. We will now begin by introducing you to the Stanford Healthcare Advantage difference. Stanford Healthcare mission: to care, educate, and discover. Our vision is to heal humanity through science and compassion, one patient at a time. The picture on this slide is that of the atrium in the new Stanford Hospital, located on the campus of Stanford University, where life-changing interdisciplinary discoveries and breakthroughs from Stanford medicine are continuously translated into patient care. The stunning new facility will set a new global standard. At Stanford Healthcare Advantage, we understand that each of our members is uniquely different, and we strive to understand those differences and know our members. Stanford Healthcare Advantage works closely with our colleagues at Stanford Healthcare and Sutter Health to ensure that the latest in clinical thinking, research, treatment, and technology is considered for our members. The coordinated medical staff cares for our patients in a team-based, multidisciplinary approach. Stanford Healthcare Advantage brings you advanced clinical capabilities, including unique programs such as our Senior Care Clinic, in which some of the benefits include home risk assessments, family counseling, and specialist referrals, all in one location. It does require eligibility screening. Stanford Healthcare is committed to developing and delivering the latest in technical advances. Healthcare is complicated and confusing, and at Stanford Healthcare Advantage, we strive to remove that complexity by offering supporting resources. Virtual online primary care visits delivered by telehealth services provide compassionate support that is highly tuned in to the needs of our Medicare population. We provide a secure online system called MyHealth. MyHealth is able to assist our patients with their needs on their terms. MyHealth is an online patient portal that creates a channel for communicating with doctors, as well as provides 24/7 online access to medical records and test results. Now that we have reviewed some of the unique differences at Stanford Healthcare, I would like to provide a network overview for each county. While Stanford Healthcare is at the heart of the Stanford Healthcare Advantage Provider Network, Stanford Healthcare Advantage offers a variety of other doctors and hospitals. Network overview for Santa Clara County. Physician Network, Stanford Healthcare Physicians, 140 primary care physicians and 1,500 specialists. Network Affiliated Physicians, 100 primary care physicians and 275 specialists. Sutter Health Physicians, over 150 primary care physicians and 400 specialists. Our hospital network includes Stanford Hospital, Good Samaritan Hospital, Regional Medical Center, Santa Clara Valley Medical Center, O'Connor Hospital, St. Louis Hospital, and El Camino Hospital. Network overview for San Mateo County. Physician Network, Sutter Health Physicians and Network Affiliated Physicians, over 140 primary care physicians and over 500 specialists. Hospital Network, Mills Peninsula Medical Center, Burlingame, Mills Peninsula Medical Center, San Mateo, Seton Medical Center, Seton Coastside Moss Beach. Network overview for Alameda County. Physician Network, Stanford Healthcare Physicians and Affiliated Physicians, over 200 primary care physicians and 600 specialists. Sutter Health Physicians, over 90 primary care providers and 200 specialists. Hospital Network, Alameda Hospital, Alta Bates Hospital, Eden Medical Center, San Leandro Hospital, Valley Care Pleasanton, Valley Memorial Center, Livermore. If you need assistance with the physician search, you will find our searchable physician directory under the search section on our website. Now that we have learned what sets us apart, we can begin to help you understand the highlights of our two 2020 benefit plans and the differences between them. This slide is intended to showcase some of the key benefit highlights and call attention to areas of difference in the benefit design between the Platinum and Gold plans. Please keep in mind, this is not a comprehensive list of all the benefits and member cost shares. For a comprehensive listing of the benefits covered under each plan and to compare the difference between them, please reference the Summary of Benefits. The Summary of Benefits for both plans can be found on the Stanford Healthcare Advantage website. There are two plans, Platinum and Gold. Both are full MAPD plans that cover all the required Medicare medical benefits, hospital care, outpatient care, and preventative services. The Platinum Plan, $99 monthly member premium, offers additional coverage with acupuncture, gym membership through Silver and Fit, worldwide coverage for travel, and prescription drug coverage. The Gold Plan, $69 monthly member premium, offers all the required medical and prescription drug coverage. Both benefit plans are available to Medicare beneficiaries residing in Santa Clara, San Mateo, and Alameda County. Neither plan requires a medical deductible. There is a slight difference in the maximum out-of-pocket, the MOOP, between the Platinum plan with the limit of $4,900 and the Gold plan with the limit of $5,900. What is an MOOP? It is the maximum out-of-pocket cost for medical services that you are expected to pay over the course of a year in Medicare Advantage plan. In other words, it's the limit to how much you will spend in out-of-pocket costs for medical services in a calendar year. Let's continue discussing the benefit offering. Primary care visit copays are one of the most widely and frequently used benefits by Medicare beneficiaries. Both the Platinum and the Gold plans offer these services for a $10 per visit member copay. There is a difference in the specialist copay between plans. While the Platinum plan offers specialty visits at $20, the Gold plan specialty visit copay is $30. Please remember, referrals for specialty visits are required. Both the Platinum and the Gold plan have an inpatient hospital copay of $275 days 1 through 7. For outpatient surgical care, the Platinum plan has a flat copay of $240, while the Gold plan has a 20% coinsurance. Lab services are $10 per visit. Tests and procedures, $25 per visit for the Platinum plan, and a $45 copay for tests and procedures on the Gold plan. Skilled nursing benefit, no prior hospitalization stay required. The Platinum plan, $0 copay each day, days 1 through 20, and a $100 copay each day, days 21 through 100. The Gold plan has a $0 copay each day, days 1 through 20, and a $150 copay each day, days 21 through 100. The Platinum plan offers worldwide emergency coverage and urgent care coverage with an $80 copay that is waived if admitted, with a $10,000 maximum benefit per year. Both the Platinum and the Gold plan offer emergency and urgent care services in the United States and territories. For urgent care, both plans have a $35 copay, but the Platinum plan offers worldwide coverage while the Gold plan is U.S. only. Physical, occupational, speech therapy, and rehabilitation, a $20 copay for the Platinum plan and a $30 copay for the Gold plan. Ambulance, a $200 copay for the Platinum plan and a $210 copay for the Gold plan. Radiology services, X-rays, are a $25 copay for the Platinum plan. X-rays are a $45 copay for the Gold plan. A $210 copay for diagnostic MRI CT scans, and a 20% coinsurance for therapeutic radiology for both the Platinum and Gold plans. $0 copay preventative services. Some examples include bone mass measurement, prostate cancer screening, PSA, breast cancer screening, colorectal screening, flu shots, Hep B, and pneumonia. A full list is provided in our Summary of Benefits, page 3. Stanford Healthcare Advantage offers a 6-tier prescription drug coverage plan for both the Platinum and Gold in 2020. The Platinum plan, no deductible, while the Gold plan has a $250 deductible on tiers 3, 4, and 5. The initial drug limit for 2020 is up to $4,020. You only pay the copays in this beginning stage. The entire retail price of the drug is counted towards your ICL, your initial coverage limit, up to $4,020 starting January 1st. Tier 1 with a $5 copay, preferred generics. Tier 2, $15 copay, non-preferred generics. Tier 3, $47 copay, preferred brand. Tier 4, $100 copay, non-preferred brand, each with a 30-day supply. Tier 5, specialty drugs, are 33% coinsurance on the Platinum plan and 28% coinsurance on the Gold plan. Tier 6, select care, $2 copay for a 30-day supply. If a member exceeds the $4,020 threshold in drug spend, they would typically fall into the coverage gap. However, Stanford Healthcare Advantage offers gap coverage for tiers 1 and 6. Our members only pay $5 or a $2 copay for drugs for a 30-day supply in these generic tiers. While in the coverage gap, members must pay 25% coinsurance for tiers 2, 3, and 4 for both brand name and generic drugs. Specialty drugs, Tier 5, 33% coinsurance, Platinum Plan, 28% coinsurance, Gold Plan. If a member reaches a total of $6,350 in combined cost, including the initial coverage limit expenses, they enter catastrophic coverage. At this point, members pay $3.60 generics or $8.95 for brand name drugs, or 5%, whichever is greater, on a 30-day supply, depending upon which tier in the formulary the drug resides. Stanford Healthcare Advantage offers preferred mail order drug program that provides even more ways for our members to save money on their prescription drugs. Through Med Impact Direct, members can receive a 3-month supply for a 2-month copayment on most tiers. Remember, Part D expenses do not count towards a member's medical maximum out-of-pocket. To review abbreviations, prescription benefits, retail pharmacies, and the formulary, visit our website at www.stanfordhealthcareadvantage.org. PA, prior authorization, is a requirement that your physician obtain approval from your insurance plan. ST, STEP therapy, is a prior authorization program that encourages use of less costly medications before the costly medications are approved for coverage. QL, quantity limits, is a restriction on the amount of quantity of medication that is covered by the plan for a specific period. Transition refill is a one-time 30-day supply of non-formulary medication if you recently switched plans and your medication is not on the formulary. Included member benefits: transportation, Teladoc, post-discharge meals, Silver and Fit gym membership with home exercise option, Platinum Plan members only. Are you looking for vision and dental coverage? Stanford Healthcare Advantage offers an optional supplemental benefit package that includes an exclusive HMO dental plan provided through Delta Care USA, and our vision insurance through VSP, Vision Service Plan, $20 per month buy-up. That wraps up the highlights and important benefit information for our 2 plans. To review, Stanford Healthcare is only allowed to accept enrollees who are Medicare eligible and reside in Santa Clara, San Mateo, or Alameda County. We have covered a lot of information today. What important points should you consider when choosing a plan? Stanford Healthcare has a rich history of delivering care to the Bay Area. A 24-hour nurse advice line, virtual online primary care visits, a member care service team that's highly in tune with the needs of our Medicare population. As a not-for-profit organization, Stanford Healthcare Advantage is able to clearly focus our energy and resources on caring for the communities we serve, educating the clinicians of the future, and helping to push the frontier of medicine through research and innovation. This presentation has provided a basic orientation of our benefits. We encourage you to access the Stanford Healthcare Advantage Plan website to get even more familiar with our offerings. You'll find materials such as the evidence of coverage, summary of benefits, a printable provider directory, and our drug formulary in the resources and download section of our website. Are you ready to enroll? We have 4 easy ways to enroll. Call us at 1-844-878-2636, TTY 711, to speak with the Medicare enrollment specialist today. Schedule a phone appointment for a future date. Complete an online application at www.stanfordhealthcareadvantage.org. Medicare beneficiaries may enroll through the CMS website at www.medicare.gov. Information and support is available in many languages. Visit our website for more details. It is an exciting time at Stanford Healthcare Advantage, and we are very pleased to be helping inform and educate Medicare beneficiaries on the unique offerings available to them. Thank you for your time and welcome to Stanford Healthcare Advantage.